Okay, so we now have another talk from the UK Health Security Agency. Dr. Naomi Coombes is going to talk about SARS-CoV-2 infection in upper and lower human respiratory MPS at high containment as a model for pandemic pathogens.
Thank you. In a similar vein to Kev, we are working with developing human models. So as we know, animals are a great model for virus infection, but we don't always get the same results in our human trials as we do in our animal models. So we are developing human models for investigating virus infections. So in this system, we're using the Emulate model. So this is a system on flow. So we have human airway or alveolar epithelial cells in the top channel. And in the bottom channel, we have endothelial cells, and we flow media through the bottom channel and air through the top channel. So we're replicating as closely as we can a human lung. So in the alveolar model, we can also apply stretch, and other studies have shown that this mechanical force is really important for the differentiation. So we're creating, as close as possible, a human lung in our labs. So we have so far done SARS-CoV-2 infections in both the alveolar, so the lower lung, and airway in the upper lung. And we get good SARS-CoV-2 infection in both models. But we've done most of our work in the alveolar model, as this is a more complex, physiologically relevant model. So once we had our models developed, we started putting viral countermeasures into these models. So you can see on the left, we've done some initial work with SARS-CoV-2 and the active metabolite of molnupiravir. So as we don't have a liver in our model, we have to provide the active metabolite. And we can see that this drug is very effective at inhibiting SARS-CoV-2 on our model. We've also done some initial work using SARS-CoV, so we're looking to be able to use this to also look at pan-pandemic preparedness. So we can see that in our static systems, as an initial lookup, this drug was also effective at inhibiting SARS-CoV. Thank you.